Let us discuss about the arterial supply of the scalp of the skull. As you can see in this diagram, I have drawn the scalp and I have drawn some arteries showing the arterial supply. As you can see in this diagram, I have drawn supratrochlear artery, supraorbital artery, zygomaticotemporal artery, superficial temporal artery, posterior auricular artery and occipital artery. So first of all, let us discuss about supratrochlear artery and supraorbital artery. As you can see in this diagram, supratrochlear artery, supraorbital artery, these are the branches of ophthalmic artery, and these arteries ascend over the forehead and accompany the supratrochlear and supraorbital nerves. These were supratrochlear and supraorbital nerve. Supratrochlear and supraorbital arteries accompany the supratrochlear and supraorbital nerves, as you can see in this diagram. Then comes superficial temporal artery. As you can see in this diagram, this is superficial temporal artery, which is a branch of external carotid artery. Basically, superficial temporal artery is the terminal branch of external carotid artery. As you can see in this diagram, superficial temporal artery ascends in front of the auricle and it accompanies the auriculotemporal nerve. This artery accompanies the auriculotemporal nerve, as you can see in this diagram, superficial temporal artery. Further, this artery divides into anterior division and posterior division. Anterior posterior division which supply the skin over the frontal and temporal region. So superficial temporal artery, which is a branch of external carotid artery, it ascends in front of the ear and divides into anterior and posterior division that basically supply the skin over the frontal as well as temporal region. Then comes posterior auricular artery. As you can see in this diagram, posterior auricular artery is also a branch of external carotid artery that ascends behind the ear. Superficial temporal artery is present in front of the ear, while posterior auricular artery is present behind the ear. It ascends behind the ear and it basically supplies the scalp over the above and behind the auricular area. Above and behind the auricular area. This is posterior auricular artery. Then comes occipital artery. Occipital artery is a branch of external carotid artery and it ascends from the apex of the posterior triangle and it accompanies the greater nerve. Then it supplies the skin over the back of the scalp and reaches as far as to the vertex. So occipital artery is also a branch of external carotid artery.